may I share the screen?
It is not possible. My apologies.
Host disabled participant screen sharing. All right, so who's my host? Is that you, Morgan? You're on mute.
Sorry, I think I fixed it.
Okay, let's try one more time. Ah, wonderful. All right, good. Okay. Okay, can everybody see my screen?
Yes.
Yeah.
All right, good. I just got a new cat too, so if I have to run out of the room for a minute, it's because a cat met another cat when they weren't ready.
Is
I
it
adopted
Beige?
Beige. Yes, I adopted Beige. For all of you that don't know who Beige is, he is the domestic long hair who we had to take his eye out, and I ended up adopting him. So I have two other cats. I have Tars, who is all black, pretty much run-of-the-mill domestic short hair. And then I have a Calico Manx, who is bottle fed, whose name is Nimue. And she's, as much as I love her very much, she's my problem child. And she's a bit cantankerous. And so I'm not sure how her and Beige are gonna, I know Beige is gonna be fine, but Nimue is probably not gonna be fine. So, and I'm changing Beige's name to Emerus. And that's the name that that's Merlin's, one of his other names is Emerus. So there's gonna be Nimue and Emerus. And if you're big into Arthurian legends, then you'll know who Nimue is. So, but enough idle chatter about that. So I will begin my presentation. So I would like to thank everybody who made time to come here today and listen to me talk to you about wildlife rehabilitation. There is so much to being a wildlife rehabilitator that I had an incredibly hard time trying to figure out what to pull and pack and stuff into this presentation, because I didn't want to bore everybody and just give you really simple stuff. But then at the same time, I didn't want to get super, super advanced and scare anybody away that might be thinking about being a rehabilitator. So this is just an introduction. What I'm going to go through is what a rehabilitator is, how I personally became a rehabilitator, some things that I've learned along the way of being a rehabilitator, which, by the way, I've been for over 10 years. And then the difference between the licensed veterinary technician and the licensed wildlife rehabilitator, because you can be one or the other, or you can be both, but you don't have to be. What does it take to become a wildlife rehabilitator? And then afterwards, if I haven't scared the crap out of all of you, I'm going to tell you the process of going through what you need to do to become one legally. And then I'm going to open it up for questions. But of course, if you have some kind of burning question that you just can't keep under wraps, I encourage you, go ahead and blurt it out, or you can try to put it in the chat, and hopefully somebody will alert me that there's there's a question in the chat if I don't catch on. Okay. I saw one cat. All right, let's see. So just to begin, that little creature that is in my hand in this photograph is a flying squirrel. So when I was doing my work in Saugerties, I learned that we have flying squirrels, and I'm almost positive that we have flying squirrels up here too. A lot of people think that they're like sugar gliders, but they're not. They have the webbed extremities, but they are very different than the sugar gliders you get at the pet store. That he looks like a little alien there, this little baby. All right. So now, what is a wildlife rehabilitator? According to the New York State Department of Environmental Conservation, a wildlife rehabilitator is a person who aids in the care and recuperation of injured or sick wild animals. So you're the one who's there when the animal gets sick. You're the one that's there when the animal gets hit by a car or something like that. You're the person who takes care of that animal. Okay. You are not allowed, when you're a wildlife rehabilitator, to collect any fees. You make no money whatsoever. And I'm not saying that in the way that some people say licensed vet techs don't make any money. You honestly do not make any money being a rehabilitator. You're not allowed to turn a profit being a rehabilitator. If I got a phone call and somebody said, hey, I just ran over a snapping turtle with my lawnmower and it seems like he's okay, but I think he needs a little bit of help. I can't say, oh, I'm more than happy to take that turtle from you. That's going to be about $75. I can't do that. That's illegal. I could lose my license. Okay. Now, if I went to the person's house and they had their checkbook out and they said, I would love to write you a check for $75, I could say, thank you so much. I would gladly take that. I've had people give me 12 packs of paper towels. I've had people give me bottles of bleach. I've had people go and give me gift certificates to local pet supply shops and things like that. And I've taken all those things, but I can't ever ask anybody for money. That's illegal. So you can't do that when you become a wildlife rehabilitator, right? So what that means then is you're volunteering your time and your money to this, okay? So that means that unlike some jobs where you clock out at 4:30 and you're out the door and the breeze is in your hair and that's it, when you do wildlife rehabilitation, you're on call all of the time. When that phone rings and it's 11:30 at night or 1 in the morning and you see that it's a number that's in your area, you pick it up. Okay. And then you have to talk to that person who's probably going to be really scared, who's going to be really upset, who's might not like what they're going to be saying, what you're going to be saying to them, you know, because you might have to tell them, look, I can't take that animal, or look, you're going to have to call the police and get that euthanized or something like that. You're going to have to interface with the public all of the time. And so what that also means is you have to be really careful about how you act in public. When you start becoming a wildlife rehabilitator and you've been one for a really, really long time, for example, I began working with the Ellenville Police. Okay. My last 2 years of being in Ulster County, I was working with the police department. So that meant that I couldn't just go off day drinking, you know, whenever I wanted and make a fool of myself and have a great time and forget who and where I was, because I worked with the police. And if somebody saw me and they said, isn't that Genevieve? Isn't she the wildlife rehabilitator for Ellenville? That might not bode well for me later on down the road. So you kind of have to have that in your mind. Not necessarily become a conformist and, you know, walk the straight and narrow, you know, but you always have to remember to be respectful and kind, even when you really don't want to. Again, there is no funding available from the state, no funding for the federal government for anything, okay? Even when you start rehabilitating bald eagles, which is the national bird of the United States, the federal government will not help you with that. So that's all, it's a labor of love, 110%. When you build those, when you see those beautiful cages and things like that, that people have, and you know, when I talk about feeding my wildlife milk that I had to purchase, or getting them diagnostic tests, or bringing them into surgery, or any of that stuff, that all comes out of pocket. All right. So it can be a very involved discipline that you are embarking on when you decide to become a rehabilitator. Okay. Now there's kind of a disconnect here. Okay. So what my life is a wildlife rehabilitator. Okay. What my friends think I do is I walk out into the woods and I have a little baby bird in my hand, and I open up my hands and the little baby bird flies away, but then it flies back and it lands on my hands, and I sing it a song and it sings me a song, and it's all sunshine all the time. And it's just like the best thing ever. It's like, oh, what, it must be so wonderful taking care of little baby squirrels all the time. And, you know, and well, that's a really nice dream. Okay. But the reality is I've been bitten by let me tell you this. The only thing I haven't been bitten by yet is a coyote or a bear. I've been bitten by an eagle. I've been bitten by a hawk. I've been bitten by regular blue jay birds. I've been bitten by raccoons. I've been bitten by skunks. I've been bitten by snapping turtles. The one bite that hurts the most, you might be wondering, is the chipmunk. I got bit by a chipmunk one time and it felt like someone had shot me in the hand It hurt so bad. When you're a wildlife rehabilitator, you never feel prepared. You're always nervous. It's usually just you and a pair of gloves. And if it's an adult animal, an animal who's terrified and who wants to fight you. Okay. So it can be really, really dangerous. If you look at that and that makes you go, yeah, I'm up for that challenge, then this might be something for you. If you're looking at that and you're like, I don't want to be that little girl running away from that swan, that's okay too. That's fine. It's better to figure that out now. All right. Just like being a vet tech. It's better to find out now that you don't want to be a vet tech than after you've been in practice for 5 years and you're like, you had to up your, you got to go to a psychiatrist. You know what I mean? So anyway, there's the disconnect there with that. What I really do, what my friends think I do. Okay. So how did it all begin, you might ask? And that's a picture of a little baby possum. Those are my favorite animals. I absolutely adore possums and I love raising them. Just a really fun trivia about possums, and I could teach a whole CE about possums if that's possible. I totally would. They're North America's only marsupial. They live between 1 and 2 years in the wild, and they have the most teeth out of any North American mammal. They have 52 teeth. That's a lot of teeth, right? So how this all began for me was I went to school and I got my bachelor's degree in mythology. Right. So for those of you that don't know what mythology is, it is the study of gods and goddesses. So like Zeus and Jupiter and Shiva, Diana, all those different gods and goddesses. That's what I really wanted to do, is I wanted to become a professor. So I got my bachelor's degree in liberal arts. But what I didn't realize is in order to be a professor in that realm, you have to get your PhD. And I was like, I don't want to do that. That's like 6 more years of school. And I just want to be an adult, so I said, well, I'll do it later. I'll do it later. And then I ended up just getting lost in the broth of the world. I started working and time got away from me. And I started to sort of like feel like there was a hole in my life. Something was like missing, right? So I graduated from college and I did a short little stint in New Hampshire where I got a job at the New Hampshire Audubon. Okay. The New Hampshire Audubon is a nonprofit organization in New Hampshire. And excuse me, they are wildlife conservationists. So they have a lot of land that's devoted to just letting it be and studying the ecosystems there and the biodiversity that exists there. And they have a lot of summer camps so look, kids will come off of the bus and they'll stay the whole day and you'll color with them and stuff like that. And one of the things that was really cool about the Audubon where I was working was that it had a couple bird enclosures. And I was really curious about these birds because I had never really seen. There was a raven, there was a red-tailed hawk, there was a bald eagle, and there was a barred owl. And I had never seen those animals up close in my entire life. And I learned that if you wanted to, you could volunteer to work with them. And I was like, oh, that's really cool. So my job was to rake out the cages, change the water, and feed them. And they said, eventually, if this is something that you really like, we'll teach you how to handle them. So I was like, oh my gosh, that is like the coolest thing ever. The one bird that sticks in my mind the most is the hawk. Now, the hawk, here's some trivia for you, okay? A hawk's vision is 200% better than a human's. So when you're driving in your car, essentially what that means is when you're driving in your car and you have your window down and a hawk flies by and happens to look in, the hawk can see if your purse is open, what's in your purse. And if it could read, it would be able to read and understand what was in your purse if you had like a book or something like that, right? Incredibly sharp vision. And that's how they do all their hunting. So this hawk had a perch, and then below the perch, there was a stump that you would put the meat on, and he ate mice. He ate dead mice. And I would go in and I would put his meat on his stump, and I would rake up all of the carrion, which is the stuff that he didn't eat. So the tail and the skull, and they don't really like gallbladders. So there was like gallbladders, like, oh, it was like gross, and I'd rake the stones and I'd rinse off all the poop and then I'd be done. But there was this little tiny keyhole right above the doorknob when I would come in and out. And it was one of those old fashioned keyholes that, you can get like real up and you can like see what's on the other side. I wanted to see this hawk eat so badly. I just wanted to. I was fascinated by this hawk. And I'm thinking to myself, he's not going to let me see him eat, because I would sit by the bars and he would just look at me like I'm looking through the bars in the front, and I'd wait and he's looking at me and he's like, what? And I'm waiting and we're having a standoff. He's like, right, you want to have a pissing contest? Well, I got all the patience in the world. I'm a predator and I do not have that much patience. So I would walk away. But I remembered that keyhole. Haha. So I got you now. So I ended up putting the meat on the stump and I walk away and I shut the door, and it's so quiet, as quietly as I could. I got right up to that hole and I'm like, I'm going to get him. I'm going to watch this hawk eat. And what I saw when I looked through that keyhole was that essentially the bird this is not him, but this hawk was looking directly at me through the keyhole. And I will never forget the feeling that I had. It was as though I was being pinned by the gaze of a dragon. It took my breath away. It wasn't a feeling of love. It was more a feeling of frightened thrill, like, oh. And what it awakened in me was a sense that animals have a whole world that us as humans have no idea about at all. Just because they're not in our vision doesn't mean that they don't exist. They have this whole world that they live in and interact with. And it really just lit that fire for me, especially for the wild and how we exist with the wild. So my time at the New Hampshire Audubon ended. I moved away. I started working at a nonprofit organization working with teenagers, and time passed and the hole started to open up in me again, where I was like, man, something is just like missing. I don't know what it is. And I remembered that hawk. And I thought to myself, I remember they said that they would teach me to like handle the hawk, but they never did. And, whatever. I wonder if there's anybody around here that will teach me how to do that. And so I ended up typing and doing a search on good old Dr. Google. And I ended up finding Ravensbeard Wildlife Center. And I interviewed with her, the lady who runs it. She still runs it. Her name's Ellen Kalish. And every day for 2 years, every week for 2 years, I went and I volunteered at her house, and she had hawks at her house, and she had owls, and she had vultures, and she had songbirds, and she had eagles, and her backyard was full of all these cages, and she had a big sunroom, and it was full of cages, and there was all these birds in there that were sick, and she was helping them get better, and she needed me to clean the cages, and she taught me how to feed them. She did all this stuff with me, and it was just the hole in my life was full. It's what I needed. I needed to have animals in my life. So I learned that about myself when I was in my early 20s. I gotta have these animals. And one day she said to me, you should be a wildlife rehabilitator. And I was like, I don't know what that is. And she was like, well, it's what I do. I have a license. And so she sponsored me to get my license. Basically, what that meant was she paid for me to go to the New York State Wildlife Rehabilitators Conference and take the test. So that is one of the ways that you can do it, but you don't have to do it that way. And I'll get into that when we get towards the end of the presentation. And so she was my sponsor and I got my license. So now I have my wildlife license. I'm like, woohoo, I can do squirrels now and I can do chipmunks and I can do all this stuff. And I kept volunteering with her. This ties into the next thing very nicely because one day we're in her garage and she's got an exam table in there and she's got a great horned owl. And great horned owls, by the way, are between like 7 to like 12 pounds. They're like as heavy as cats, but they're way bigger. She's got it by its talons. She's got it by its legs. And she's holding its legs and it's on its back. And we have a towel over its head. And she goes and it's struggling and it's angry and it's like trying to claw her throat out. And I'm like so freaked out. And she's like, Genevieve, she's like, take that syringe and fill it up with the bag of IV fluids and stick it into its leg. And I'm like, what? She goes, stick the needle, give it a subcutaneous injection. And I'm like, I don't know what that is. She goes, all right, I'll walk you through it. And I got this feeling like, is this okay for me to be doing? Like, should I be doing this? She's like, it'll be fine. It'll be fine. So I did it and I was so terrified and I took the bevel and I stuck it in the skin of the bird and it was, bird skin is so transparent that I could like see the needle like in there and I pushed the fluid in and I saw the bubble of fluid grow underneath and I took the needle out. And she looked at me and she goes, oh, you should be a licensed vet tech. And I was like, what the hell is that? I had no idea. I had no idea what that was. Now, listen, you might be saying, how did you not know? I didn't know because I come from an old school family who never took their animals to the vet. The only time an animal went to the vet is when that animal was going to get euthanized. And my parents never told me that that's why they were going. They were like the whole, we drove it to a barn somewhere type of parents, right? They never told me when an animal was going to die. And when I had my own cat, when I went into college, I brought him to the SPCA to get him neutered and he got his 3-year rabies vaccine and that was it. And he never got euthanized because he ended up getting probably eaten by an owl, now that I think about it. So I never had that experience with being inside of an animal hospital. It was completely foreign. But what she said to me really stuck. And I was like, oh my God, that's a thing I can do. And then I thought to myself, I don't do math, I don't do science. I got my degree in mythology. Like, I'm sure I couldn't do it, but it stuck with me. Right. So now I'm in my late 20s and I'm 30 years old. Okay. And I have the hole again. The hole is open. And I think to myself, man, I really don't like working with teenagers. I'm kind of over it. It's just really hard. Working with teenagers. And I'm not really sure if this is what I want to be doing for the rest of my life. I was like, I wonder if I can go to school to be a vet tech. It would certainly help my wildlife rehabilitation skills much more. So I ended up going to school to become a vet tech and I got my license. So I got my license to be a rehabilitator. So I ended up getting my rehab license first, and then I ended up getting my vet tech license second. Okay. You can just live your whole life just as a rehabber and never become a licensed vet tech. And if you become a rehabilitator, or if you ever meet rehabilitators, you'll find that many of them do not have the educational background that you all have going through a vet tech school. Doesn't mean that they're not good at what they do. It's just a different, and I'll explain a little bit more about that. It's just a different way of being, a different way of getting into rehabilitation. Okay, so what's the difference? What are some things that vet techs do versus what rehabilitators do? Now, I use the verses on purpose because working in a hospital, I saw other technicians when a rehabilitator would come in and they would kind of get this like toot about them, you know. And rehabilitators on the flip side would kind of look at vet techs like, you know, like, ew, you guys, and it's not, they're not conflicting philosophies if you really get down to it. It's so helpful. Being a vet tech, I have found, has been incredibly helpful for my rehabilitation because, for one thing, I know what it takes to nurse an animal. I know how to nurse an animal. I know what a sick animal looks like. Okay. I understand anatomy and physiology much better. I didn't have to learn that by making all the kinds of mistakes that somebody without a formal education would make, like about the pneumatic bones in birds, for example, and why you can't just give a sub-Q injection any old place in a bird is because you might accidentally drown them. Okay. Or what is that piece of meat hanging out of that? Is that an organ or is that a muscle or something like that? Okay. Anatomy and physiology has really, really helped me out. I know how to do fluid therapy. I know how to do those calculations. I know how important nutrition is. I know how to administer medications. I know how to tube feed. I know how to do IM injections. I know how to do all these different things. I know how to read medical manuals. Being a vet tech, there's a really good chance you're going to end up knowing some veterinarians. You need to have that if you are just a rehabilitator, because you're going to have to ask for the help of a veterinarian at some point. Not all veterinarians are going to want to help you as a rehabilitator. You must know this when you walk into an animal hospital as a vet tech. Some hospitals are not going to let you bring in those baby birds and those baby squirrels, okay? And they have a lot of reasons for doing that. So you can't just expect all DVMs to be on board. I worked with a DVM who was terrified of birds. She said, do not bring birds in here. I will run right out. I will run right out. She couldn't even go near a chicken. Okay. So, okay. Hey, you got to work with what you have, you know? And I think maybe most importantly and most overlooked is that as licensed vet techs, we're able to walk away from our emotions enough to be able to look at an animal and say, okay, it's time for this animal to move on to the next phase of its existence. You know, it's time for it to, go to heaven or go pass away or, go to the other side or, whatever words, cross the rainbow bridge. You know what I'm saying? I'm saying euthanasia. Okay. We know how to look at an animal and assess that. Whereas sometimes a person who's not medically trained might have a lot of material around that makes it much harder for them to recognize when it's time, and then the animal ends up suffering. Okay. Some things to consider though, as a vet tech, are some things that might not necessarily be helpful when you wear your rehabber hat. Okay. And two of those are, we're trained to collect data. All right. We're trained to draw that blood, get that pee, get that poo, take those radiographs, do all that stuff. Okay. That can stress a wild animal out a lot. I've had animals die right on the table. Rabbits love dying before your very eyes. Okay. And birds, they'll just die. They'll be like perfectly fine, and you can literally scare them to death. So the more stuff you do to manipulate a wild animal, the more they can die from fear. So doing those things that are just basic understanding for us with our dogs and cats and horses and cows, this is just what you do, can scare a wild animal to death. Secondly, we place a lot of importance on pharmaceuticals. We place a lot of importance, and rightly so, on antibiotics and NSAIDs and opioids and steroids. A lot of what we do is figure out what's going on and throw drugs at it. And that works very well for our domesticated species. They've lived with us for a really, really long time. And we design our drugs and we test our drugs specifically for those animals. However, wildlife, totally different. Not a big market in there for testing pharmaceuticals on wildlife. It's really, really hard to guarantee that you're getting good data on wildlife. Therefore, they don't really develop medicine specifically for wild animals. There's no profit in it. So, I mean, that's a reality of it. But also, it can mess with their bodies in ways that we would never consider. Take, for example, antibiotics. Now, what's one of the main problems that we encounter as veterinary technicians with animals being on antibiotics? Does anybody want to shout it out? What happens to an animal? Crickets. What can it develop? If you were thinking diarrhea, you were right. The antibiotics can give animals diarrhea. They can give people diarrhea too. Okay. Maybe, well, anyway, yeah. So that's not really that big of a deal with adult dogs and cats. It can be, obviously, if they're still really compromised, but it's not necessarily the end of the world. But if you have, let's say I have a fox and I've given a fox some clindamycin and the fox has developed diarrhea. I'm trying to battle an infection. Well, now he's got diarrhea. Now he's dehydrated. Now I have to also combat the diarrhea. So I have to give him something for that. And now I also have to give him fluid therapy. These are all more times that I have to lay my hands upon this animal. These are all more times that this animal is going to be terrified and I might kill it. So there's sort of like, there's a different way that you need to go about things that as vet techs, we have to step away from when we wear our rehabber hats. And that little fella in that picture is a little field mouse that I raised and I let go. And those are some Cheerios in there. Okay. The rehabber has to rely, the rehabber doesn't have that blood work, those radiographs, the fecal. Most rehabbers, although I know a couple that do, have microscopes, but most don't. So the rehabber has to rely on the senses, okay? Sight, touch, smell, hearing, hopefully not taste, then you're getting too close. Okay. You don't want to be tasting your animals. All right. Usually you're going to end up working alone. I've had to either work alone or I have to rope my boyfriend in, which he doesn't want to touch wild animals. That's not fair for me to ask him that. In fact, I remember one time I asked him, he walked in, I had this squirrel. It was an adult black squirrel and it had botfly, Cuterebra. It had 2 botfly. And they were like ready to come out. And it was just me. All right. He wasn't even like home from work yet. Right. So what I had to do was I had to cut a liter soda bottle, the bottom out, and I wrapped the squirrel in a towel loosely and I stuffed him in there. I stuffed him in there so he thought he was in a tree and so he wouldn't fight me, because as long as they're like squished nicely, they think they're safe. Much like rodents, if you remember rats, right? So he comes home and I have the squirrel, the business end, right? Because it was right near his umbilicus, right? So I have that and his penis hanging out of this soda bottle, and I have a pair of tweezers and I'm trying to pull this giant worm out, and the worm is right next to his penis. So my boyfriend just walks in and he sees me manipulating this squirrel hanging out of the soda bottle. He just walked by. He was like, nope, don't want to know. So and that's perfectly understandable. But when you're a rehabilitator, you're going to be doing things by yourself a lot. When you're a vet tech and you're working in a hospital setting, it's kind of a luxury that you at least are going to have an assistant that's going to be with you, if not another if not another technician. You're going to have a lot of hands. So that's a nice thing. But when you're a rehabber, you got your rehab hat on, you got to figure out what you can do by yourself. The other thing is too, when you're a vet tech, you have an animal, your animal comes in, the animal gets its examination, veterinarian gives you some medicine to fill, and then you walk over to the client and you say, you have to give Fluffy 1 Rimadyl once a day until the pain goes away. Make sure that she takes it with food, and monitor for any signs of pain at the end of it. And then they walk out the door, and then, 2 days later, you do a follow-up call, and that's it. When you have your rehabber hat on, you have to consider that you're never going to see that animal again. That animal has to take care of himself completely, 100%. You can't let an owl go who can't catch food yet and say, he's almost done with his healing, but he needs to finish up his healing at home. You can't do that. When you let an animal go, it's got to be able to eat and it's got to be able to breed. If it can't do those things, you either have to place it in an educational setting, keep it a little bit longer, or you have to euthanize it. So that's a different thing than when we do how we do animals in the hospital. Okay. So now, since I just was doing a whole bunch of business talk, I thought maybe you would like to see a video. So like I said before, I really enjoy, let me move my little roster out of the way because I like watching this video too. So I have these possums, and when I got them, they were very, very tiny, and I had to tube feed them 4 times a day for weeks. And then finally they got to be to the point where it was time for them to start learning how to eat on their own. So they were about 2 months old. I didn't have anywhere to put them. We had a bathtub in our house that didn't work, a shower that didn't work. So I ended up moving them into the bathtub. And please excuse the quality of this video. I took it with my phone. I'm a licensed vet tech. I'm not a photographer. So that's your disclaimer. They are just the cutest little things. He's eating his banana. They love bananas. Possums love bananas and papayas. So what I ended up doing was I ended up taking a whole bunch of newspaper and laying all this newspaper down on the floor of the bathtub and covering the drain. And then I took straw and also wood chips, and I put this layer. I was trying to emulate the forest floor. So I ended up putting, about an inch of that down on top of all that newspaper. And then I took a post office box, like one of those little cardboard boxes. That was their little cave. And it had a little hat in there because they like to snuggle still. So they would all live in that. And then that one tray, you can see right here, this tray is a sushi tray, one of those shallow sushi trays. And then over here, this lid is a peanut butter lid. And that is those are the 2 the 2 food dishes that they had. And then there was a water dish a little farther down. And that's how they lived for 3 weeks. And then as they got older, obviously it ended up working pretty well. And then they went out into their outdoor caging so that they could get used to the sights and the sounds and the patterns of the sunrise and sunset, moonrise, moonset before they ended up getting released. Made me really sad actually, because they were kind of my friends. But you got to learn how to let things go when you're a rehabilitator. It's very important. All right, so what exactly does it take to be a wildlife rehabilitator? You might be asking yourself. I will tell you. You have to have patience with yourself. You will make terrible mistakes. You will make mistakes that will make you feel like you just want to crawl underneath a rock and die. There is no standardized textbook on this. There is no scientific journal on this. There is no college degree on this. It's just you and your scientific mind. And you must forgive yourself when you make those mistakes. You have to. It sucks because an animal ended up dying because of it. It sucks. There's no way around that. Absolutely. However, you have to make those deaths count by learning from them so you become a more effective rehabilitator. If that's something you don't think you can do, that's okay. Be patient with the public, okay? Yes, they dumb. Yes, they dumb. However, they decided to call you instead of just let the animal die or go on Dr. Google and figure it out themselves. So please always make sure that you thank them when they call you. Always try to answer their questions, be respectful, even when they aren't respectful back, which is really, really tough. But the worst thing that you want to have happen is that they have a bad experience with you and they say, you know what, screw it, I can do this by myself. And then you have situations like one time when I got a whole batch of baby rabbits from a lady because she figured that she could take care of them by herself. And she looked it up on Google, and somebody on Google told her that the best kind of milk to give a rabbit is oat milk, like OAT, oat milk. Who milks the oats? I don't know. Okay. So just make sure that you say, thank you very much. You know, I didn't browbeat her and be like, eh. Even though I wanted to, I said, thank you so much for giving them to me. Your timing was perfect. You got them to me just in time. Even though they all ended up dying, I said that to her because if I hadn't said that, the next time she found rabbits, she wouldn't call me. Be comfortable with the sights of pain, fear, and death. You're already on the right track becoming a vet tech because you're going to see some stuff. Okay. Wild animals usually come to you, and it's not because, like, when an owner calls up and they're like, my dog farted today and it smelled different and I want to bring him in. Usually an animal from the wild is coming to you because it's been laying in somebody's hot summer lawn for 3 days and it's not dead yet. You're going to see maggots. You're going to see severe infections. You're going to see a lot of human ignorance. You're going to see animals with lead poisoning. You're going to see animals that have been shot. You're going to see animals that have been run over on purpose, or animals that have been attacked by dogs and things like that. You must rise above the emotional toll that it can take on you and look at all those things like data. You can't make bricks without clay, right? As Sherlock Holmes says. So you got to look at it all like data. Be comfortable with those sites. Know a vet who will help you. As I covered before, not all of them are going to be like, oh, wildlife, my favorite. So make sure you have somebody who's supportive of you. Okay. Be cool with spending your own money. You will spend a lot of your own money. Okay. And then most importantly, you got to be willing to let them go. You got to be willing to let them go, even though they're the cutest little critters in the whole world. And maybe I can just keep them as a pet. Mm-mm. And you got to be willing to let them go when they need to be euthanized. Release, the word release doesn't always mean release, fly away. Sometimes it means released from the body, and it needs to be at peace. Okay, so you need to be willing to do that for an animal. Sometimes the animals will take days and days. A lot of people say to me, hey, you know what? Why don't you just let an animal go in the woods? Like, you know what I mean? Like, yeah, it's really, really sick and it's injured and everything, but so why don't you just let it go in the woods and let nature take its course? And what I say to that is because sometimes nature can take days what will only take me about 5 minutes. And those days will be filled with a lot of suffering. And I don't want that. All right, so if I haven't scared the crap out of you yet, let me tell you how to become a rehabilitator officially, okay? You got to be 16 years old, which all of you are, I'm sure you're all past that, hopefully. If not, way to go getting your associates or bachelor's at 16, right? You got to register for the exam on the Department of Environmental Conservation website, and you have to pass it with a score of 80% or higher, which some of you in this Zoom room already have. Congratulations. Very good. After that, they're going to send you a paper where you fill out the application to get the license. See, the exam just says you're allowed to get your license, but then you actually have to apply to receive your license. A new addition to this process is you're going to have to schedule an interview with a DEC representative. Not really sure what that entails because I didn't have to do that. Pretty sure what they're doing there is they're going to make sure that you have the right connections that you need, that you know a veterinarian, and that you're not going to become a squirrel hoarder or something like that. Okay. They want to know what your goals are and what your personality is like. Now, there's a lot of different licenses that we can get. Very briefly, I'm almost done, and then I'm going to cover those licenses, and then we'll open it up for questions, okay? Class 1 and Class 2 licenses are your most basic ones, okay? You're allowed to care for small mammals, reptiles, amphibians, and certain birds like house sparrows, starlings, and game birds. So those are your turkeys, those are your pheasants, those are your grouse, stuff like that. Rabies vector licenses will allow you to take care of raccoons, skunks, foxes, groundhogs, bats, and coyotes. And if you want my opinion, even though I don't think you have asked, I would go for bats because bats are in a lot of trouble right now and we need the bats. Now, after the rabies vector, you move up into your federal licenses. Those are the licenses that allow you to take care of raptors, which are your hawks and your eagles and your occipiters, such as the falcon, that's an occipiter, your owls, passerines, which are any migratory bird, which pretty much all of our birds except turkeys are considered migratory, and waterfowl, and your marine mammals. So those are going to be your otters and stuff like that. You need federal licenses for those. Also, you can get a falconry license that will allow you to hunt with a falcon or a red-tailed hawk, but that's different from wildlife rehab. And you're also not allowed to do educational programs with them unless they're specifically about falconry. If you wanted to become a wildlife educator, you would have to get one of the licenses I just went over, as well as your educational license, and that would give you permission to keep between 3 and 4 animals. But it's a really, really rigorous application. They come to your house, they inspect it, they make sure your enclosures are up to snuff, they make sure your program, your educational program is up to their standards and things like that, okay? So in conclusion, wildlife rehabilitation is a huge discipline. It's one of the most enriching and rewarding things that I think a person can do with their life, but it might not be for everybody. If you got through this PowerPoint today and you've decided that you do have what it takes, I want you to know that there's a huge support network out there for you, and we would love to have you on board. If you just decide, hey, I just want to be a licensed vet tech, that's awesome too, because someday, somehow, a rehabilitator might walk into your hospital, and then you're going to know exactly what to expect and what to do for us. Go ahead and volunteer and donate if you want. I don't know if these links are live for you on your PowerPoint screen, but there they are. All right. Thanks so much. Does anybody have any questions?
What license do you have?
That's a great question. I have a Class 1 license, and I also am an agent for Friends of the Feathered and Furry. So what that means is I'm allowed to do the small mammals, the reptiles, and the amphibians, and I'm allowed to keep migratory birds and raptors in my care for 24 hours, as long as I intend to transport them to Friends of the Feathered and Furry after that 24-hour period. Anything else?
So for wildlife rehabilitation, would you need a second job since you don't get like paid, or how would that work?
That's a great question. Okay, so um so would you need a second job? I mean, I'm always going to say yes, you should. Can you make enough money working just one job to do rehab? Yeah, you can. You just have to be really careful. My advice to you, if you just wanted to work one job and maybe do a little rehab on the side, would be make sure that what you're taking in are the small mammals, and make sure you know about other wildlife rehabilitators around you who can take on the burden if you start getting overwhelmed with phone calls. But you could certainly do that. You could certainly work one job. I would say, if I wanted to give you a rough estimate, when I first started, I think that maybe I spent on supplies maybe between $500 and $700 a year. Now that I've been doing it and I've been getting so many, like I got 97 wild animals last year. Now I'm spending upwards of between $2,000 and $3,000.
Okay, that's a lot lower than I thought for some reason. I thought it was going to be more expensive.
Well, I also have a rehabilitator who she runs a 501c3. And so any animal that needs surgery or anything like that, she ends up taking because she can do the long-term nursing that an animal needs. So when she takes an animal and she brings it into surgery, she pays for it out of pocket. That's Friends of the Feathered and Furry. Okay, Missy Runyon. She probably spends in the tens, if not hundreds of thousands of dollars a year for her. But she does bear, coyote, fox. She actually has the only bear enclosures in New York State, other than the ones that are up in Syracuse. She has a huge eagle cage with a trout pond in it. She's awesome. I really recommend looking her up. Okay, so she spends a ton more money doing it. So as you can see from what I'm saying, Amanda, there's a range there.
Yeah, I can tell. Okay. Thank you so much. This was great.
Yeah,
Have
you're
a good
so
day.
welcome. Awesome.
I think that's all for questions we got for today.
All right, cool. Well, like I said, I'm so honored to have been able to present to everybody, and thank you so much. And good luck with all your exams and all the ways, okay?